Oh, morning, Mike.
Good morning.
Oh, I got a
Wimpy.
sore hip. Actually, I don't. But seriously, I've got two relatives over the age of 60, and they're walking like that. Sore hip, not using a cane yet, but maybe they should be. So I thought we could make a video with exercises for these people and everyone else. What do you got to say, Mike?
But instead of repeating ourselves for 1,000 times like we already do, we decided to bring a old popular video with Bob and Brad specifically talking about this, and for the older demographic, ages 50, 60, 70 plus.
You don't have to call them demographics. Just say for the older crowd. We're very pleasant.
Crowd.
Anyways, let's get on with it. We're going to show these favorites, but do we have to...
We actually have a couple more to add after the video, so we will come back.
Yeah, because you won't be able to do all these, and we need some better options. I think they're by Rick.
Oh, they are by Rick, our friend.
More will come. You'll see.
But are we going to time travel? I thought you liked your TARDIS stuff.
Oh, yeah. Let's get right into it. There we go. Then we're going to go through the vortex in a very calm manner this time. None of that
really
craziness.
need to watch Doctor
The
Who to
vortex is
understand
coming.
this better.
Yeah, the TARDIS, not the tortoise. Doctor Who. Maybe we could get him on the
Maybe.
show.
Which one?
Bob and Brad, the two most famous physical therapists on the internet.
So, 3 miracle exercises. I have used these exercises with other patients, and sometimes they work wonderfully. And
Right.
They honestly, they take people who are in the grass, are just about ready to have hip surgery,
Right.
and pull them away from it. And
Yeah, so typically, these are these chronic hip pains. Oftentimes, it's not like necessarily from an accident. Say you
Right.
fell down or broke your hip.
in
or
fact, if you fell down or injured it, I wouldn't recommend these exercises.
Right. Or if you had hip replacement, these
Right.
are not going to be for you.
And they're not for back pain either. I mean, if your
Right.
back pain's going down your
Right.
hip, and it's not for children or adolescents.
Right.
It's just not effective.
Well, who is it for then, Bob?
It's for, again, the older person who's having pain. You might think it's due to arthritis. It might be due to arthritis. And you still do want to stretch it because quite often, rather than getting the pain from the joint itself, you might be getting from the structures around the joint.
Right.
They're
Some
all
of those
too
muscles,
tight.
tissues, capsule, etc.
Yeah. And so by stretching out the hip, a lot of times the pain goes down. And again, I've seen this with myself, and I've seen it with others that I still am able to run at age 59, heading towards 60. I'm on the slope, Brad.
Slippery
And-
slope.
yeah.
Bob, it's almost 3 minutes. These
Oh,
people
all right.
want to. They want to
Let's
see
start
the
off. Number one,
stretches.
there's only 3. So the first one is the hip flexor. We're
Yep.
stretching the hip flexors. I'm going to go this way, Brad.
Okay.
Just so you throw a pillow down.
This is the muscle in the front where your front pocket is. Right in there. It's deep.
Right there. Now, what you're going to do, you're going to set up, put your knee on the soft pillow. You're going to lean forward like this, and you're going to take the hand here, and
Oh,
you can actually push
right
it
there.
forward like this a little bit. But I also want to have you take that foot and put it out that way a little bit.
So if it's your right leg, it goes out towards
away
the right.
Away from the body. If it's the left leg, it goes to the left, out, away from the body. And while you're in this position, keeping a good upright posture,
Good
you're
tall
going to
body.
do pressure
there.
on,
Oh.
pressure off.
Do you do this stretch, Bob?
I do.
Yeah, you can tell because for 59 years old, that's a really good range of motion.
Right. Yeah.
Do you color your hair, Bob? He said no gray hair hardly.
I got that from my mom. My mom actually, she laments about it. She
Oh.
wants to have gray hair.
Oh.
And she does have some now, but my mom is almost 90 years old.
Well, let's get on with the stretches.
Okay. So we're going to do this like, I'd say 10 times, 10 repetitions, 4 to 6 times a day.
Oh, really?
Yep.
So get for how long, though?
What do you mean, for how long?
For weeks, months?
Oh, I mean, until the pain starts going away.
Sure, yep.
And once the pain goes away, then you can do it probably once a day, just maintenance.
Maintenance, sure,
Yeah.
okay. And that goes for all of these, correct?
This goes for all. It's 3 exercises, 10 times. It's going to take you, what, a couple of minutes?
Right.
And I realize, people are going to say, well, I can't do this 4 to 6 times a day. Well, then you're going to go in for hip surgery, and, you're going to have a major disruption to your life. And
Now, I do want to put the warning out. If this stretch does create pain, particularly sharp pain, that's a red flag. It means you're doing it too hard, or it may be a problem in your hip and you should not do it.
Right. We're looking at maybe a little bit of stretching pain, but nothing significant at all.
And as you do more, it should feel like it's loosening up and
A lot
better.
of people like the feeling of this one, Brad. In fact, if you get to the point where the pain is gone or manageable, you might only have to do this one. This is probably the main one that you have to do. Okay, the second one is you're going to stretch the hip into flexion. So I'm going to grab this one, Brad.
Right.
Okay, so all you got to do, you're in your chair, you can be at your office, you're going to stretch up, and again, pressure on, pressure off. You can do 10 repetitions. Now, if you really want to get to it, you can lean forward even like this, or lean back, I'm sorry.
Slide your buttocks
Slide your
forward.
butt forward, and then you can really give a good stretch to it.
And just relax and breathe while you do these. You know, it's one of those things that as you breathe and relax, things stretch much better.
It actually feels good. This is one I do not do.
No, you don't.
I don't know. I just felt like I've not needed to do it.
Yeah, and if that's the case, then you don't need to. But it does feel good.
Yeah, it does feel good. I'm kind of surprised. Maybe I'll start doing it. All right, the next one is, and I also perform this one, hip external rotation. You can do this on the floor, but again, easier to do in the chair. So you're going to put one foot across. You're going to put the ankle across the knee of the opposite,
like that.
And you're going to press down.
Not too hard.
Yeah. Pressure on, pressure off. Pressure on, pressure off.
I'll just show them how you can do it in bed.
Sure.
See how it's the same thing except for you're laying down.
What I like about this one is you can actually compare sides really easy on this. We've done this before. So if I put the other one up and it's way up like this, obviously this one's a lot tighter, you know, than the other one. And again, pressure on, pressure off. Now this is the one I also do. I did it this morning. I do it every morning. I'm able to keep my hips in good condition so that I can keep running.
So I multitask with this one, Bob. When I put my socks on the edge of the bed, then I do it because my foot's already there.
There you go.
And just a few stretches, put the socks on, stretch a little more, and go to the next one. And
that's a good point. Yeah. Make it a part of your day. And
exactly.
Then it's one thing, it's a reminder to do it then also.
Yeah.
But, you know, if you have a desk job and you're working, you know, on a chair, obviously these two are so simple to do. You know, these are easy to do 4 to 6 times a day because you just go like this.
Right.
I mean, people won't even around. You won't even notice.
Exactly. Or they might, everyone in the whole office might be doing them.
Yeah. And if they notice, they go, oh, it's just that Heineck again.
Yeah,
what's he doing now?
Nutcase.
Yeah. Give those a try. Give us your feedback. Let us know if they work for you. Because we always we've seen them work with our patients.
Yeah.
But of course, they're not 100% effective, but they help a lot of people.
Yep, they certainly do. And they're simple. Again, don't overdo them. Take your time with them. And Bob, what else do we always say?
We can fix just about anything.
Except for
a broken heart.
There you go.
But we're working on it.
That was smooth, huh?
Yeah, really smooth.
Whoa.
You're back.
It feels good. Those are nice stretches. But like we said, not everyone will be able to do those. Let's go with the options that we talked about. What are they?
Yeah, so the last stretch Bob was showing, the hip flexor stretch kneeling. Some people do not like to kneel.
Yeah.
So we can do an option in a chair, which Brad will show here. And then we have one off the edge of the mat. So it's the same concept, just a different way to do it.
Right. Now, this chair will not be for everyone either, and I'll show you why. You should have a stick or a cane like this, and a firm chair. It's not for a soft, cushy, loungy chair. A firm chair with armrest, firm, solid armrest. Scoot your butt forward, turn sideways so that if I'm going to stretch the right hip, my right butt cheek actually comes off the edge a little bit. I'm going to use this to balance because, you know, if you're not steady, you could go down and have a problem fall off the chair as well. If you don't feel steady with this, wait, and Mike will show you the safer way to do it. So here, and I'm just going to inch my foot back. If you don't have socks on, or if you have your shoes off, you can slide it back on a smooth kitchen floor. And then I'm going to sit up tall. That's why the cane is also handy for a second thing. I can feel the stretch right in here on that hip flexor. So I can go here and stretch, or just hold it. Breathe in, breathe out, and relax. And then, of course, do the other side as well. Some people have one side that's tight. Maybe it's because of an accident or something in your history. So do what you feel is best. Mike, what is the easier and safer way to do it? Yeah.
Well, you're probably going to need to move that chair way over there.
Oh, yeah, absolutely.
It's going to be in camera's way.
Absolutely.
So go to the edge of something firm. If your bed is firm, or you could put something underneath it, like maybe another pillow. You can also do this on a countertop. Maybe you just happen to have a plinth or a sturdy kitchen table. Bring your knees up to your chest, and you're just going to drop one side down like this, and then bend your knee. Bring your opposite knee towards your chest. Your leg will pop up a little bit. Just let gravity stretch your hip flexor down, and try to relax and breathe. Hold this for 30 seconds. I'm trying to keep my leg in a nice straight line, not let it venture off to the side like this. And then after you do one side, reset and switch legs. Do the exact same thing. This is kind of nice for some people that maybe have some back pain because it supports your low back, keeps you in a nice neutral position, and you don't overarch too much doing it. This is also how we test if you have a tight hip flexor, actually. So
Yeah, the Thomas test.
Yeah.
Now, can you show them, like, I don't like to go off the edge of my bed, and I'm not going to climb on my kitchen table. If you slide back here, you can do this on the edge of your bed. It doesn't get as nice of a stretch, but I think some people may be their safest and most comfortable option.
So try to get your leg off the edge. I try to almost get my butt cheek off the edge. If you're not going to slide off, make sure you feel safe, and then slowly bring your leg back. So here I'm not feeling a whole lot of a stretch. The more I bring it back and bend my knee, the more stretch I'm feeling. Obviously, the height of your bed is going to make this more aggressive or less aggressive of a stretch, but this is another way you can kind of do it. If you don't feel comfortable on the edge like I was just showing.
Now, you may not have to contort yourself, and if you're older, you probably will not be able to get that much. Why don't you bring your leg?
Some people are here and they can't even touch the ground because they're
Right.
so tight. So you may have to put a pillow on the ground to support your leg just to let it slowly go, or just even here. Some people just getting this much extension I've seen can be problematic for them. So they just start here and hang out for 30 seconds to maybe even 2 minutes if they're comfortable.
Right.
And then you just have to do the other side. But yeah, I have worked with people this tight before that are, more in the 80s, 90s, but
Yeah.
it does happen.
Very good. Work carefully with it and stretch those hip flexors. Now, we do have another video that relates to this.
How to
but-
stop hip pain fast, all you need to know.
Oh, very good.
So click the video link on the screen and you can check that one out.
Yeah, don't get too aggressive with these right away. And I'm very happy with how this turned out, Mike. The vortex, everything went through the time travel well, and it was a good stretch. So my hip's better. Thank you.
Good.
Be careful and have a good day.
Bob and Brad, the two most famous physical